What were some of those lifestyle changes that you made?
I was a young college student, and
Say no more. I'm somebody who wants to have kids in the future too, and you go through any of those precautions.
for lack of better words, I threw caution to the wind a little bit on that one.
I was always wondering if the pain is like if it's, you always hear this, if it's comparable or not. But
Everybody was like, you don't get any trophies for not getting that epidural, Megan.
Welcome to Rarely Discussed, an American Porphyria Foundation podcast with your hosts Andrew McManamon
and Nicole Castellano.
We have porphyria, a rare disease. Rare diseases differ greatly but share many similarities in how they affect our lives.
Being rare can feel lonely and isolating, but we're stronger together. Join us in meaningful interviews with porphyria and rare disease experts and the patients and families impacted as we connect, learn, and heal together.
We'll talk diagnosis, treatment, pain, mental health, managing daily life, and everything rare. Welcome to Rarely Discussed. We are on, we're going to say season 2, new year, new season. We are on episode number 14. And as always, Nicole, I always talk about we have so many special guests. So we have another special guest. Can you do the honor of introducing?
Absolutely. I am honored. That's a good word to say, to introduce my very good friend, Megan Parrish. She has acute intermittent porphyria. And she is from Little Rock, Arkansas. And she has done, she's a huge advocate. She's done a lot of media. You might recognize her from the Queen Charlotte episode that was kind of on the news that we shared on our website, on the APF website. So she has a great story, and you'll want to wait till the end to hear this because I have chills. Megan has had, I should just let you say it, but she's had some really great luck with porphyria. So it's very exciting. And so Megan, let's just kind of get into it. I know we when we met, we realized that we were both diagnosed in 2008 with acute intermittent porphyria. And when we met, we just became fast friends. And you've just been so wonderful. You've been so generous with your time with the APF and with porphyria, just sharing yourself and everything. So thank you for being here today.
Well, thank you guys for having me. I'm excited to be here. And you and I, we really did just hit it right off the bat. I mean, that first time we were in the convenience store and you had the chocolate covered donuts and I had the powdered donuts.
I was telling Andrew about that before he got on. And then we're like, I'm going to send him the picture,
I was like, this is my porphyria snack. And she's like, this is my porphyria snack.
Yeah. The same.
I was like, okay,
sure. Donuts, like it was, and also I think I said around every night in the morning, 3:30 in the morning, she's like, me too, and we're like, no way, this is crazy. It was, I figured that was from porphyria, but I didn't really know until I heard from, because I hadn't met really very many people or no one in person, so it was great.
Yeah, I was kind of the same way. I mean, I feel like I didn't really know. I talked to a few porphyria patients online. But didn't know anybody in person. And then I feel like I just met everybody.
Yeah.
And now we had a good little crew that we all, kind of created a little support group for each other. And it's been great. And, I guess we don't really talk as much online in our group chat anymore, but still love all the girls for sure.
Yes. And we have a special name for a group that we will not share.
Yes. It's appropriate.
But it's not like explicit or anything necessarily, but it's just secret. So Megan, can you if you could maybe just run us through what I know for you it was a long time before you got diagnosed, like it was for me and so many patients. If you can just kind of start with that, and I know that I want to congratulate you on your little one. You're a new mom, and
Thank you.
it's very, everyone's talking a lot about pregnancy and porphyria and everything. So at some point when we get in your story, if we can talk about that a little bit, I think it'd be really great for people listening to relate to and everything, and just hear your experience. But just take it away and just tell us how it happened.
All righty. Well, if you got any questions along the way, feel free to stop me and ask. I don't mind. But yeah, so I started having symptoms around puberty, not unlike a lot of porphyria patients, especially us ladies. The hormones kind of wreak havoc with porphyria, especially for me. I found that monthly with my cycle, I was just having issues. But at that point, as a teenager, I didn't know what was going on. So my mom she took me to every doctor that she could get to listen to us, tests, exploratory surgeries, all sorts of different things on this journey to find an answer. And there were a lot of setbacks along the way. There are a lot of inconclusive results, of course, a lot of negative results. All these common symptoms that, could be linked, as y'all know, to much more common illnesses.
Right.
And, you don't necessarily get all of your porphyria symptoms at one time. I mean, certainly in like a big attack, I might have all of the ones that I get to enjoy at one time. But, if I'm just kind of lingering on the outskirts of an attack, I might just have one or two symptoms. And, without having the big picture, I think it was really hard for doctors to kind of see what was going on there. And, they're trying to pinpoint more common illnesses. So, of course, you've got a young teenager that's got severe abdominal pain, and her mom has a history of endometriosis. So, like, she must have endometriosis too.
Yeah.
So, it's just, why, they're taught in med school that, don't go chasing after zebras. And
right.
They're really trying not to, make waves. And so I think that was a huge issue in my case. And I ended up switching primary care physicians my senior year in high school. The doctor that I was seeing accused my mom of having Munchausen's, and that, like, there's nothing wrong with me except for that she had that. And so that, we both needed to go to therapy, and she didn't want to see me again in her office for another lab test. And, my mom did not accept that answer. And we were very fortunate that we got into another doctor so quickly, because had that accusation kind of gotten out, it would have even hindered my diagnosis process more. So we saw another doctor, and I think that him, we got all of my history to him. And I think him looking through all the history, all these different symptoms that I had presented with, he got it as a bigger picture. And he hadn't seen like a real life porphyria case. And I want to say he was probably in his 40s, maybe 50s at the time. So this is not like a new doctor. He's, an experienced PCP. But he remembered porphyria from med school. And he said, this is a long shot, but I want to test you for this. And so it was, of course, a simple test, 24-hour urine collection. We've all done those.
Yeah.
And so we did that. And sure enough,
the best story that she had to pee in the dark. So
yeah. So, of course, we did that. And the test came back positive. So he sent me on to a specialist, and we tested again. Sure enough. So that was like, okay, so we have this answer. And for me, initially, I made some pretty extensive lifestyle changes. And I saw a pretty good immediate improvement overall with my symptoms. I was still having some pain and some nausea, but I wasn't like doubled over every month. I wasn't vomiting my guts out. I was functioning with the symptoms that I had. And so in my mind, I was like, well, this is as good as it gets. And like, we're good. And so I just started living my life as a college student.
Can I ask you a question really quick? What were some of those lifestyle changes that you made that were helpful for you? Because I know it doesn't, we all have our things, and not everything works for everybody.
Well, I was a young college student, and
say no more.
I was smoking cigarettes and drinking a little bit of alcohol. which are big no-nos for us porphyria patients, as you guys know. So those were some big ones. Also eliminated things like nitrates from my diet. I eliminated all soy products from my life, including toiletry. Like, I realized I had soy in a lot of my skincare. And I don't know. I just was looking into all sorts of stuff, and soy can cause extra estrogen production. So I was just like, well, no more soy for me. And then I quit taking birth control because I thought, well, this is definitely probably part of my problem. And I still think that was a huge issue I was having also. So there's just a lot of different things. And I'm sure there was more, but.
Oh, no, thanks. I just wanted to just jump in there really quick. So go ahead. I'm sorry.
No, you're fine. So I made these lifestyle changes. Things seemed to get better. Went on my normal little college way, decided to go live out of the country for a while and do my internship for my degree. And lo and behold, I get back to the States, and man, I am sicker than a dog. And I hadn't gone to see my porphyria specialist in years, y'all. I had just blown off every appointment that I had with him for quite some time. And, I was kind of living in denial, I guess, at that point. I was just like, well, I'm normal. Yeah. And so, that attack ended up having me in the hospital for almost 60 days. I was fighting for my life. I got C. diff. I got mono. I got pancreatitis. I crashed. They had to crash cart me. I had an out-of-body experience. Wow. I mean, it was nuts. I spiked a fever of like 106 at one point, had a seizure. They, packed me down in the ice blankets. And because I'd been over in Europe and had been speaking in Italian, at one point I refused to talk anything but Italian. And so, of course, I was like, oh, we don't know what to do now. And then when my mom finally could get me to speak in English, all I said to her was, they prescribed me 2 pepperonis. She loves to tell me that. She's like, remember that time you told me the doctor prescribed you 2 pepperonis for your porphyria? Well,
I think we should start a new thing, pepperoni for porphyria,
Yeah.
Yeah. That's a t-shirt idea. Let's go.
There you go.
But yeah, so that was probably the most brutal attack that I ever went through. I mean, I definitely had other really hard ones, but that was the first really, really bad one. And that was the first time I got panhematin. I didn't have a port then. I mean, we were all just flying by the seat of our pants. The doctors, me, my mom. So, I mean, I was mainlining panhematin. I got phlebitis and cellulitis in both my arms.
Me too, yeah.
So that was extremely painful on top of already being in pain from the porphyria. So, of course, that led to PICC lines and ports and that whole journey down that path.
Didn't you have 12 port one time because they had to keep putting it in? And
yes.
I remember I was just like, oh my Lord. Because I mean, I'm on my 5th one, but I had never met anyone else that had and still,
panhematin can be pretty.
I've never heard it.
Panhematin can be pretty corrosive, and I was just getting it so often. I mean, sometimes I was in the infusion clinic 4 times a week, getting panhematin. So, they weren't surviving. They would last like a year or 2, and then, I wouldn't get a blood return, or they wouldn't be able to push fluid, and I'd be going to get another one. Part of my problem was I was super stubborn initially, being young and in my 20s. At the time that I got my first port, I was actually about to get married, and I had just bought this strapless wedding gown of my dreams. And so the doctor's saying, we're going to put a port in your chest. I mean, I'm sitting there in my hospital bed just sobbing. And so I think mostly the surgeon just had pity on me, and he was like, we could put it in your arm. They don't work super great there always, but we can try it. And so I think part of my issue was that it was in my arm and I kept putting it back in my arm.
Yeah.
And they have to use like a smaller port when they put it in your arm. And so the tail, the catheter line is even smaller than a chest port. So I kind of caused myself, my own problems there. But I finally had too many in my arm and had so much scar tissue that they couldn't fish another one down in there. And so they said it was time to move it. So but I'm really, really glad. And I've only had to replace my chest port once. And that was when I was still going really strong with infusions and stuff. But this one, I want to say she's like almost 5, which is crazy because like that's the longest I've had one.
You still get it flushed even though you're not having treatment as much?
Yeah, I go I'm supposed to go every 6 weeks, but I don't always.
Why do we not do what we're supposed to do ever? Like, we know we have to do it and we don't do it. It's just great.
But she flushed beautifully just a few weeks ago and gave good blood return. So
what do you think triggered the attack when you came home from out of the country?
So, in Romania, I was working with a nonprofit that does a lot of work with like agricultural stuff. And so I was eating like super clean farm to table food. I was eating good, but I was eating very clean. And I came back here to the States and immediately like the first thing I did when I got off a plane was get a McDonald's cheeseburger.
Of course.
And so I think that like I just kind of threw my system into a shock. And I think that that's really what it was. Because I was back home for maybe like 2 weeks before I started like not feeling super great. And it just escalated from there.
And I know the good news that Nicole was talking about earlier was just the fact that you've been able to keep this streak going. I mean, aside from, are you still focusing on soy-free products and things like that, or lifestyle changes, or what are you focusing on to keep that going?
I do my best to behave myself. At this point, so I actually went back to Romania in September of 2021. There was like a big 10-year reunion with me and my friends there, and it was really nice. But so right before I left, I'd actually not had an infusion in like 6 or 7 months prior to that trip. But plane travel sometimes has been a trigger for me in the past.
Yeah.
And so my doctor was like, let's just give you like a preemptive infusion. That way you can enjoy your trip and you're fine. So I got one the Friday before I left on like the following Monday. And so I really didn't even need that one, but that was the last infusion that I got. And I've been great. It's wild to me. It's mind-blowing because I think about the hours I've lost in, tethered to an IV pole. And it's nuts.
Well, I couldn't be happier for you. And I know I am always like, you still good? I'm always very excited because I always say, oh, I know that it's possible that one day it's possible anyway, that I won't need to have infusions anymore. Everyone's like, well, yeah, but, and I'm like, let me believe it, and I'm like, and then then Megan's, I'm like, see, I told you, I knew it was like, I'm very invested in this. And, I love you so much too. Obviously that's the biggest reason, but I just think it's wonderful. And you've been through some major life events, that could trigger, right? Like when we're talking about hormones and everything like that, and you've been able to navigate and manage like so well. And I'm just so happy for you. And like, I know you always say, if you could bottle it up and, if you knew what you did, that it's amazing.
Yeah. So, I kind of, at the point that I was at, I asked Dr. Emanuel, I've been healthy this long, like, would it be safe if I tried to have a baby? Like, are we like that good? And he gave me the all clear, and he was very supportive. And, we knew going into it that, God forbid that if I needed it, panhematin could be administered while I was pregnant. And so, like, we had all these fail safes in place, and I was at a high risk obstetrics clinic with doctors that he had worked with before, not with porphyria patients, but he also has like cancer patients that he sees. So these are doctors that my porphyria specialist was comfortable partnering with, if something had happened. And so, I mean, I just had a really great team of medical professionals, and just overall, my whole entire pregnancy and the birthing experience was great. I felt amazing the whole time, except for, the last little bit was kind of rough because you're just so big, everything hurts. And like, it's not porphyria hurt, but it hurts for sure.
Yeah. I was always wondering if the pain is like, if it's, you always hear this, if it's comparable or not, but I would assume porphyria is probably worse, but I never had the chance to go through that. So
it's so funny. So right before I got the epidural and labor and delivery, so my mom was sitting in there, and I'd been kind of like toughing it out, and just kind of laboring through it. And, everybody was like, you don't get any trophies for not getting the epidural, Megan. And I was like, no, I don't get it. I just like was waiting for it to hurt worse.
Yeah.
And everybody was like, we're not sure your like metric for pain should be where we're saying this, but there was a certain point I was like, oh yeah, that hurts. I don't want it to get any worse than that. So, but I did tell my mom right as I was about to get the epidural placed, I was like, it's definitely not the like least painful thing I've ever experienced. I said, but we already know what the most worst painful thing is.
Yeah, for sure, man.
I mean, I'm so curious too, just because obviously I'm somebody who wants to have kids in the future too, and I have people telling me, oh, you got to genetic counsel, you got to look into IVF, you have to look into all these different things to make sure this, that, and the other thing. Did you go through any of those precautions, or did you just say, you know what, this is where I'm at, I'm gonna just go for it?
Yeah, I just kind of, I mean, for lack of better words, I threw caution to the wind a little bit on that one. I mean, I talked with my doctor about it, and honestly, I feel like with where we're at as a community with porphyria, I have a lot of hope for the future. We are getting Maggie genetically tested, but I have a lot of hope that regardless, whatever the outcome of that test is, that by the time she's, pubescent and going to be experiencing symptoms, that we're going to have way more options for treatment. I just have this feeling on top. I mean, we're already, I mean, since I got diagnosed, it was just glucose and panhematin, and we've got something new now that I never could have even dreamed would exist. And so I can't imagine, give it 16 more years. I mean, like, so I'm less concerned about it as far as that goes. I think that we're at a point now as a community that we're making progress versus where we were when I first came into the community, where like we had been in the same place since the 80s,
Yeah.
So.
Yeah. And I think I know, well, we all do as much as we can, especially when we're feeling better, to try to create awareness and everything like that. And I know, the APF being around for like, over 40 years, and, and all the pay, now with social media, people can you can get so much more information. We've talked about this before, like when I was first diagnosed, the only thing, I mean, the internet in 2008 was great, but it wasn't what it is today. And, so I ordered Desiree's book, and that was the first thing that was it. And then just then the APF started getting more and more support, and the support groups and everything like that. So, you're right. I mean, like we're in a very exciting time right now.
Yeah.
With all this, there's a lot of research going on. Drug companies are interested in helping porphyria patients and stuff like that. So that it is very exciting. So I definitely hope that she doesn't have the gene, but if she does, I think it sounds like you've got a great attitude going into it.
Well, we've seen porphyria like on so many shows over the last few years. I mean, I mean, people know, at least have heard the word porphyria. And I mean, like, I've gone into doctors' offices, over the last couple of years. And when I say I have porphyria, I don't get met with, what's that anymore? People know. So it's cool. It's cool to watch this shift happen in real time.
Yeah.
Yeah, and it's crazy going back to awareness too. And I was talking to Nicole, I think it was a couple weeks ago about this. And when I was looking up stuff initially, and I came across your stuff that you had been putting out, I think it was it's probably 4 or 5 years old by now, the videos. But I remember seeing that video and just hearing your parents' take on it and things like that. So I think the power of awareness has come so far. It's been insane
Yeah.
to be able to spread awareness like that. So
And Megan,
definitely
I'm
appreciate
sure
you
you
doing
saw
that.
Andrew's video. He did this really great video a couple of years for Porphyria Awareness Week, and it was great because obviously we know with AIP at least it's more women have it than men. But Andrew, you've been such I mean, I'm just gonna say it again. When I saw you and Derry together, kind of bonding at ICPP, it was just really nice, and I just love that you are just so, again, just like Megan is, generous with your time and talking about things like that, because there aren't a lot of people that are. I mean, there are a lot of people doing it, but you did it really really well, and I know it's helped a lot of people. I mean, you can just look at the comments. I know people contact you all the time. So, and Megan, I remember when I met you, when the first thing that you were on TV for something, and somebody actually called you and said they got diagnosed.
Mm-hmm.
And
Yeah.
that happened to me too. Somebody just a half an hour away from me, from just doing a news thing for Porphyria Awareness Week. And they're like, "Oh my God, but now I need a doctor." Like, where are you going? It's amazing. I mean, even if one person it's so helpful.
Well, and I always put the bug in, like, any new doctor that I get. They get the spiel whether they want to or not. But I have a lot of doctors that'll then tell me when they see me again, "Hey, I found another one of you."
See, there you go.
I'm like, yeah, we just start appearing. We know if we find a doctor that'll treat one of us, that's like, we all come, we're like, where are you?
Exactly.
Mhm.
It's true. No, it's true. And we've been doing a lot with, like you said, that you went to your PCP first. It's the first one that thought of it. I mean, and that's kind of rare. We've been focusing on GPs, PCPs, nurse practitioners, physicians assistants and stuff, because a lot of those that they have a lot more time, with patients, and they can think about it. Almost every single nurse practitioner I've been seen by has said, I've never seen anyone, but I've tested for it a bunch of times. So I just love hearing, like we do for Porphyria Awareness, we think Porphyria, and when you're doing that, it's great because you're always educating, and now, like, look at that, just because you at least two people were, and I'm sure it's a lot more have been diagnosed, so you should feel good about that.
And the other day, I don't know if you have this issue, but I it's hard for me to remember sometimes that I've done these videos, and then, like, obviously in my real world, like, nobody's coming out to me being like, I saw your video.
Yeah.
But so I'm at the doctor's clinic a couple weeks ago, and I'm in the waiting room, and some random woman goes, "Oh my gosh, you're Megan." And I'm like, "Yeah." And so she's like, "We've talked online." And I was like, "Oh, okay." And I'm like, "I was so sorry." And I was like afraid that, I was like, what does she recognize me from? What did I do something wrong?
Am I in trouble?
Yeah.
Am I Megan? I'm not sure. Let me just
Like, maybe I'm
Wow, that's great. Yeah, because that was the thing you did with your doctor and the Queen Charlotte, that was local, right? So and that's the thing that's so important. National is great, but just getting out in your local community, and it's nice because, you can be there for each other too, physically, if you want to, if people are kind of usually connect and stuff like that. So it's just, you know it's I think that we don't realize how much these things, you think, oh, it's just local, I'm just one person, but it makes a
It
difference.
does. It adds up.
Yeah, and even when we were in Spain too, I feel like, of course, like we're always virtually meeting, we're always chatting, which is awesome. But I feel like there was something special about that,
Oh yeah.
being able to have lunch with each other, breakfast, and then going to the conference and then talking afterwards. It was just there was so much connection in that in just such a little time. So I think definitely local because I mean, even if there's one person that's just a city away from me or a couple people a couple hours away, it's very helpful.
And even if you don't meet all the time, just knowing I don't know if you guys feel like this, but for me, just knowing that it's there, it just you just feel, I don't know, I just felt better. And we're gonna be doing a lot of inpatient meetings this year. I always keep doing in-person patient meetings. We used to do a lot of them, and then because of Zoom, it's so much easier, and it is great. It's awesome, and you don't have to be feeling. You can be in bed and do it if you're not feeling well. Like it's easier, but that connection, like you're saying, it's just like when we met, it was just like boom. It was just like it was awesome. And every person I've met, I mean, even if it's just like virtually, it's incredible. There aren't a lot of us, and so it's just neat. But that the connection's great, but definitely in person. Um, just I don't know. There's just something. I don't know, but you guys, would you say this for you too? It's like instant. It's like you just understand each other in this way that not many people can.
Yeah.
Not may not know each other very well, but with that you do.
Yes. I mean, like, there's something to be said about somebody that doesn't like look at you and like you, like they get it, but they don't feel sorry for you, if that makes sense,
Yeah. Yeah.
They just relate.
Yeah.
Yeah, it's like you don't even have to say anything to that person, and you're just like that person. You're like they get me for
Yeah.
sure.
Yeah.
There's not like there isn't that awkwardness or trying to be like I don't really know what's going on here. I mean, usually most people are just like, "What's going on, vampire boy?" And I'm just like, "Okay,
You're like,
whatever.
thanks.
Appreciate it, whatever."
Yeah. So, it's y'all know it's hard to describe every aspect of what porphyria is like to somebody who doesn't have it. And so just having somebody to talk to that like gets it, and you can just be like, hey, I experienced XYZ symptoms today and they sucked. And then just like have a like, oh yeah, I totally get it,
And it's
That's
funny in our group in our group chat that we have, there's always at least someone who's doing well that can be like, all right, sometimes some people are sick, but there's usually at least one person that can like hold everybody up, because it may not be, it's never the same person like the next time, but but usually, but it's
yeah, that was our role for a while, that like not all of us could be well at the same time. Like
yeah.
if we did, something catastrophic might happen.
Absolutely. Yeah.
So how is life really look? I know obviously you've been on this streak, but how has life looked for you now? I mean, are you still? Do you feel like Porphyria is still peering it's looking at you a little bit, or have you just tried to forget about it and be like, okay, I'm normal? How are you? How are you going about that?
Somewhere in the middle between those two.
Yeah.
So I don't want to go back to like old college Megan who's like, I'm normal, because I'm not
Uh-huh.
normal. And I'm sure that like if we really went, crazy, I mean, I'm sure we could do something. So I'm not gonna say, it's not possible.
Right.
Um, but I mean, I try not to constantly be looking over my shoulder and waiting for the other shoe to drop. I just try to live like as much of a normal life as I can, while still like being cautious about things that I know are potential triggers for me. Um, you know, I've been able to kind of do some things that I probably wouldn't have, when I was sick. I've traveled more now, and since being well, and I like having a baby, and so I am kind of living normal, but that's still there in the back of my mind. And there are days that I'll kind of let my brain be like, oh, what if tomorrow I wake up and like the good streak's over. But I try not to let that sink in, and I'll just be like, nope, we're not not going there. And so right now I'm just kind of claiming my wellness and trying to enjoy every minute of it and make up for all the lost time. And yeah.
I think it's good too, because I think it's very important that you're saying, I'm not saying, and this would be almost like reverse denial, what we were talking about, like, oh, now I'm fine. It's just like anyone who has the genetic mutation, even if they've never been sick, you know what triggers you. So if you stay away from that and you take care of yourself, you should be good. And then, if you start feeling it, you'll know. If hopefully you never will, because you're my hero and you need to stay well. But it's just I think it's that, just again, it's about awareness and knowing yourself. And I think for a lot of new patients, like, well, how do I know? And it's like, and we've talked about this before, Andrew. It's like, I think after having the disease, or just having an active disease for a long time, the longer you go, the more you realize what works for you. You talk to other people, try things that work for them. When we met, we were at a lunch, Andrew, like you're saying, just like out eating. And I've had migraines, my ever since I when I got my period, like it was kind of when it started, when my hormones changed. And my mom had migraines, so I just thought it was just migraines. And like you were saying before, when you're young and you don't know what a period, everyone says, oh, I have cramps. You don't know that what you're having is different from like someone else. You know what I mean? And but anyway, we were talking and everyone's like, oh yeah, headaches or a thing of porphyria. And I'm like, what? Like, I had no idea. Like something simple like that, and I was just like, oh. And everyone's like, yeah, yeah. And I'm like, okay, but I know now when I just feel better when I have a headache. I just feel like I'm more good. It's weird, and I have them a lot, but you know what I mean. But like, it's, you know what I'm saying? I don't know. It's just.
Well, there's so many things. Like when I finally got my diagnosis, even things that I hadn't thought were like associated with what was going on.
Right.
When I got like the list of these, it could be all the potential porphyria symptoms, I was like, oh.
Right.
Because it's just so broad in how many systems of your body that it affects. It's bizarre. You just don't necessarily think all this stuff is connected. So it's easy to see how even doctors would be a little confused.
Yeah, absolutely, for sure. So
I sometimes feel like it's hard to find that line, and I know that there's been people in the groups that have talked about it too, where they're like, is there like a spot or an area where people are like, you know what, this could be porphyria, but then people are really pushing porphyria to be the reason for everything, and it could be other things, and it's like, where's that line at where it's not porphyria, and it's a tough spot to be. But
I think that I'm at the point now where, if you see how long like some of us had to wait to get a diagnosis, and then like all of that, like the exploratory surgery. I mean, like Nicole, like all the surgeries they put you through. I mean, goodness.
Yeah.
And I mean, like, so you have all these people going through exploratory surgeries when, like, I mean, a 24-hour urine, like 24 hours is it takes a little long, but I mean, how much of your time does that really take? You're not like, doing it the whole 24 hours. So, I mean, it's a pretty simple test, and it's not expensive to perform, so I just say test them all.
Exactly, right? And now we have, random spot urine, which is great too, and not a lot of labs don't have it or know that they have it or whatever. So again, it's about education and awareness and saying you can get it, or they do have it. You're just not aware of it because you've never done it before. You know what I mean? So it's, but you're right. It is, it's the way you just said that was kind of really profound for me. You're like, it's just so easy. I don't know. I've thought that before, but the way you just said it, it's like, just test everybody. It's 24 hours. You know what I mean? But I hear a lot of people that come and they say, my doctor said there's no way I have it because it's rare. And it's just like you said, it's not this, like, you have a free DNA test, and then you also, these urine tests that aren't expensive. They do have to be handled, the samples have to be handled properly and everything, but it's just like there's still that that unknown thing, that it's just like, why is it so difficult? Like how hard is it to just order the test? It's not like something that is like so difficult and expensive.
I have a theory. Now, this is just my personal theory, but I've watched like our community rapidly growing, like people getting positive results. And so like I'm watching like the new members of the APF and like, like how many new people we're getting on the Facebook pages and stuff like that. So my theory is, yes, porphyria is rare. I'm not saying that it's like a super common, condition or anything. But I think that because, people weren't testing for it or weren't even thinking to test for it, I think it's actually probably more common than we think. Like, I think there's probably more of us than we know,
Yeah. Mm-hmm. Yeah, like you said, I think I agree, and I know it's always going to be rare because even people that have it, only 5 to 10% of people have
symptoms,
stuff like that. But yeah, look at how much look how it is. It's this education and awareness. It's a big thing, and it's having those tools to be able to just bring and like Andrew and I were talking about AI earlier. Like, what's that going to do? Like for doctors, like to say, okay, look at something and see what pops up and what else could it be, and just go, I can just order that test. I mean, like you said, your doctor was like, oh, for medical school. And I always hear everyone's like, oh yeah, in medical, I haven't heard about medical school. And everyone's like, oh yeah, I remember when patients, or even Desiree, but a lot of people will be like, oh yeah, I remember the urine being dark. So it just, it hits their brain. And so it's just, it's great that, the more, like you're saying, even though you're not sick, you're still telling people about it just to say, hey, if you ever run into this, and I do the same thing. And I'm just like you said, whether they want to hear it or not, you never know, you never know. So,
I'm curious though, Megan, like with everything that you've gone through and just where you are now, for somebody that's listening, I know that they're paying attention to each word that we're saying, but what advice would you give to somebody right now who's maybe in the very early stages, maybe trying to get diagnosed, outside of course, just yell at a doctor to test me, but what would you, what would you say?
First of all, advocate for yourself. Like nobody knows what's going on inside your body better than you. So don't give up. Keep advocating for yourself. And I know that sounds like easier said than done, but you just have to push through. There are medical professionals out there that like care and want to listen. Not everybody's just going to be like, "Oh, you're fine. You're normal. It's all in your head." And I know a lot of us have had those kind of experiences. Past that, get into some of the Facebook groups and other like social media stuff. Find people in the community that you can talk to and, that are at the same place in their porphyria journey as you. That is one of the most invaluable things that I did. And I actually stumbled into that on accident with these amazing women that we all found each other and we're at the same place in our journey with porphyria and how sick we were, and just having that camaraderie and people to sound off with, and just like knowing that there was somebody like over here that cared what was going on and like they could understand what I was going through, and it was just nice to have that. And it makes you feel less like an island. Porphyria can make you feel very much like an island, because like in your own local community, you'll probably be the only person with porphyria. Right. And so you'll feel very much like an island. And so having people that you can sound off to, I think that's super important. Past that, if you get a diagnosis and you're headed to the infusion clinic, bring blankets, bring a pillow, get comfy, settle in.
Don't be stubborn about your port.
Yeah. Go with the chest port, not the arm port.
Yeah. I think too, what you said, what you said is so important, that, keep advocating for yourself, believe in yourself, because it is hard at times, because we've talked about this before. We knew that something wasn't right, but when you're told for years that you're fine, you start kind of going, is it, I know it's not, but like, how come they can't find, what I'm saying? It makes you doubt your own, not sanity necessarily, but just, your doubts, makes you doubt where you're at. Like, is this really happening? You know what I mean? And I think that, like you said, having that sounding board. And, some people don't like to be on social media a lot. They don't like to in a big group of people. We also have a program now called Porphyria Partners, where we can kind of put you with one person that has the same type, and if see if you guys kind of hit it off, and then you have that one person that so you're not like, it doesn't have to be as, I guess, as public, so because everyone's different.
Yeah.
But just having, and the other thing too is having that hope, keeping it alive. Like when you do have those other people, when you are having that day, I saw Terry Witter was on the other day. She's like, I can't do it anymore. And it was just that one day. She's like the strongest woman I know, but you get those days, and then you have the people that say, remember, you're going to have this just today. It's not like it's going to be like this forever. And so it's just, the same thing. I had the same, very similar journey with the APF and getting support and everything. And again, meeting people in person it was crazy. It was crazy. It was just so great, So.
And I think it's remembering too that I know we always talk about advocating, but I think just remembering that it's just advocating is not an easy thing by any means.
No.
I think
Especially
that's just reiterating that.
Yeah.
Right. And I think something that I've been hearing a lot lately is just people, although going after their doctors and trying to get them to do this and trying to get them to do that, just understanding that it's okay to get a second opinion. It's okay to pick up and move somewhere else,
You're
even if
right.
you're starting over. I mean, people think you're starting over from scratch and you have to relive all the horribleness again. But if there's a doctor that's actually willing to listen, it by far, it just is way better than that person that wasn't for so long. And I think people just understanding that it's okay to get a second opinion. It's okay to jump through a couple hoops to get more answers and get somebody who's actually willing to listen to you and do what you ask. I think that's just an important thing.
It's very important. And, I like I said, I talk to people all the time. We all do. And it's like the doctor just, they won't do they won't, there's like, they won't do the test. They just won't do the test. And I'm like, well, not, sometimes you just can't force it. And if the doctor isn't, they may just not feel comfortable with it. They may, for whatever their reason is, like, and then if you just try, we have a database of over 6,000 doctors, and we're adding doctors all the time and trying to get as many in, especially rural areas. People don't have to drive so far for a specialist. And we consult and everything. So doctors that want to learn something, they can consult with an expert and kind of be walked through if they want to learn. But, it's just, it is. It's that it's not easy, and especially when you're sick. I mean, I don't know about you guys, but if you're in the hospital, you can't concentrate on anything that anyone's saying. Like if you didn't, like if my mom wasn't there, my dad, I just don't. I don't know. I wouldn't have been able to, I just couldn't. I tried so hard and I couldn't understand anything.
Yeah, no, I mean, my parents definitely were huge in that front as far as like advocating for me, and even my mom during my diagnosis process, not just when I was in the hospital and stuff. So I mean, when you're sick out of your mind, I mean, like the last thing you want to do is answer questions or
Right.
Difficult.
And that's something that I haven't really told too many people about it, but of course, when you turn 18, you're your own adult and everything like that. And even if you have a parent or guardian, it still is a pain in the butt with the doctors. So I had my mom become kind of my medical advocate, and that was just a game changer for them to be fighting back after me, and then her just whip out this legal document saying, you can't, what are you going to do? So I think that was very helpful.
That's great, Andrew. Yeah, I mean, the having a support system. Sometimes it's your family. A lot of people, because they are told for years that you're fine. The family a lot of people feel like family turns on them. They're not there, but there's, it doesn't matter who it is. It can be a friend. It can be a spouse. It can be, just, another Porphyria friend. I mean, look at Anne, right? She's like the mama bear. Candace's mom. She just fight. She's just crazy. She's just like fight for any patient. She's even like getting something. There's someone in Australia, and she's just like texting me. She's like, "We need to send this. We need to do that." And I'm like, "I'm on it. We got it." And she's just. We have a really great community. We were really lucky. so we can, if we can't find it maybe in our network, we can maybe find it, we just have to keep looking. I think there's always, if you just keep looking, there's going to be someone that's going to have your back, and help you with that, even if they don't live near you, you know what I mean? So.
Yeah, for sure. There's got to be, I don't know how, I know people do it without the support system, but I don't know how I would have done it without mine. It would have been almost impossible.
Yeah. 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 I think that's true. Well, I don't know. You guys want to wrap up? I'm so excited, Megan, that you were on. I've been wanting to have you on for a while, and I know you've been a little busy having a baby and everything.
You want to see her before we go?
Yes.
Let me get her. Will you bring her to me, babe? Can you?
Oh, hi there.
Good smile.
She's beautiful. Just like her mom. Which is first of all, Megan, she looks like you, but she's blonde. She's like, I was blonde when I was born too. And I'm like, wow, so she's a little mini me. Hi there. Hi, sweetheart.
She's looking at the keyboard. My dad, so she comes to work with me every day. And my dad, like immediately when I come get there, he takes her into his office and he sits there and reads the newspaper and he lets her like type on he unplugs his keyboard and lets her like tick, 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 tick on it.
Oh, so she's looking like, hey, let me do this now.
So she's like, oh, I know what those are.
That's a good toy. It's always the one that you don't buy that's the one that they love.
Yeah, the empty white packages are the Tom's toy. Mm-hmm.
Well, Megan, I hope with all of my heart that you continue to stay on this health journey, and I have faith that you will. And if God forbid something happens, you'll be on it. And I just really appreciate we were able to get you on here today. And I think your story is just so it's very impactful. Everyone's story is impactful, but I just think it's great. We have a lot of people. We've had people on that are still kind of in the process, and then people that have been diagnosed, and then now you've gone through this, and now you're in a great spot. So I think that's going to give people a lot of hope. Thank you.
Yeah, like I always say, if I can like make one person feel less alone in their journey, it'll make it all a little bit more worthwhile, not in vain.
Like, this wasn't for nothing.
Yeah.
That's great.
Well, great. I wanted to just reiterate that when I saw your video so early on, I just appreciated you doing the awareness, because even 4 or 5 years ago, there wasn't a ton of stuff out there for porphyria still. I mean, obviously social media and Facebook and everything was a lot more than when you guys were initially getting diagnosed, but there still wasn't a lot. So I saw those videos, and when Nicole mentioned that she was planning to have you on, I was like, we have to. And I know it took so long to get you on, but I definitely appreciate you making the time, being a new mom and navigating life. So,
well, thank you guys for having me. I enjoyed it. It's always good to get to hang out with Nicole, even if it's virtual. We need to get in person.
I know. We're still coming up to go rock hunting by you, I promise.
Yes, come on. We got all the crystals your heart could stand.
I know.
She's like, there better be a 7-Eleven for some donuts over there.
Yeah, that's right. Yeah, we got to do that for sure.
We can go to Walgreens for the donuts.
Yeah, there we go. I literally think of you. I was in Walmart the other day and I saw I every time, even if it's not the donut, anything Hostess, I'm just like, Megan, just so funny.
Have you seen some of the new flavors that they have?
Yeah.
There's some good ones. I mean, like, I don't have the porphyria cravings anymore, but I do occasionally indulge in some donuts still.
Oh, yeah. Yeah, well, I definitely, I was telling Andrew before we got on that, I've been having some crazy, like, middle of the night things, like, I end up dropping while I fall asleep while I'm eating it, and then I wake up and it's like stuck. Claire, she said something, she's like, oh my God, and I'm like, that happens to me like all the time. She's like, really? I don't feel as bad now.
Yeah, the sleep eating was wild there for a minute.
Huh?
I said the sleep eating was wild there for a minute.
Yeah, it's crazy. Yeah, and then you don't know. If you don't talk to people, you think you're the only one. You kind of like feel a little crazy, but then it's just like now I'm like, I just whatever I want. I just
sleep eat, and they're like, you sleep eat? How do you eat while you're asleep? Like, how do you not know? And I'm like, you just don't know till you wake up, and you're like, oh, I had an entire bag of gummy worms. Cool.
Literally before you got on, I was telling him, Mike, I came to bed late because I was having an insomnia night. And I was like, he's like, I didn't sleep that well. I'm like, oh, is it because I came, I woke you up or something? He's like, oh no, it wasn't that. It was just the he's like, it was just the constant like crinkle. He just took like a plastic bag and he's like, shh, like all night. I was just putting my hand in the gummy bears. I ate the whole bag. And I didn't even realize it. And then he just said that.
That's funny.
All right. Well, thank you so much again, Megan. I love you, and I'm so glad you came on. And we'll hopefully have you on again soon.
Thank you, guys. Anytime, just let me know.
Thank you for taking the time out of your day to listen to our podcast. If you enjoyed this episode, please share it with friends, family, or anyone who could benefit. And please don't forget to subscribe and leave a review on your preferred platform. It helps us spread awareness, and we would be extremely grateful. You can also follow Rarely Discussed on Instagram, YouTube, as well as TikTok. If you're someone seeking diagnosis for porphyria, visit porphyriafoundation.org to receive a free doctor packet, forms for free DNA testing, and a list of doctors in your area. Stay tuned for more episodes of Rarely Discussed.